My name is Emma, and I just finished a rotation at the Adults Doing Life Skills Clinic at the Center for Disability Services on campus. It's a clinic that serves adults who have aged out of the school system, so they're 26 and older with intellectual and developmental disabilities. You're at their day program, kind of giving them services. We did a huge psychosocial focus this semester, which was really, really cool because we got to kind of think beyond the basic like biomechanical and all of that stuff and delve more into, okay, how is our treatment actually impacting their lives and their functioning? We also did a lot of documentation practice and a lot of evidence-based research practice, which has made everything that I'm doing in my classes this semester way easier. We talked a lot about theory and really learning about that theory that underlies it, and I just feel like it really prepared me well for my level 2s. I feel like I know a lot more of what I'm doing because I had all of that hands-on experience and really had to think critically about everything I was doing.
Hi, my name is Kelsey, and I'm currently doing my second level 1 fieldwork placement at Meltrotter Ministries, which is a homeless shelter in downtown Grand Rapids. This experience has been such a unique experience to Western. I probably wouldn't have gotten the chance to work as an OT in a homeless shelter at many other universities, so I'm really thankful that I've had this opportunity. I get to work with kiddos of all different ages and all different backgrounds who are living at the shelter, and we focus on developing emotional regulation, which is such a great skill to have because no matter what pediatric setting you work in, that's a skill that you're going to want to develop in all your kiddos at all different ages.
Hi, I'm Kayla.
And I'm also Kayla.
And we were at the Kalamazoo Psychiatric Hospital, also known as KPH, over the summer. And this provided us with a great opportunity, especially being at Western Michigan University, because not other colleges get the chance to have this experience. Kalamazoo Psychiatric Hospital is one of the only psych hospitals in Michigan.
Kalamazoo Psychiatric Hospital is a very well-established hospital here in the area, and we were able to work on several units within the hospital, which gave us experience and exposure to several mental health diagnoses, which will be very beneficial to our career as occupational therapists, since we'll be faced with clients who suffer from many diagnoses in addition to the physical deficits they may also be experiencing.
Okay. Hi, my name is Sam. I'm currently a second year student at Western's OT program. One of my level 1 clinics was at the pediatric clinic in Grand Rapids. I was lucky enough to have a placement there. I do have an interest in pediatrics. I'm a non-traditional student, so before I even applied to the program, I spent 5 years teaching elementary school. So I initially had thought when I would start the clinic that it'd be a little bit easier of a transition for me, but I learned that there's a lot to be learned from these clinics. They are led by faculty, so you have the opportunity to not only see your professors firsthand in their kind of in their niche, but they know that you're a student, they know what you've learned, they know exactly what you know and you don't know, and they really, it's really the monumental aspect of this program, and one of the biggest reasons why I decided to come here was learning about this. Prior to applying to this program, I obviously did shadowing experiences, and I didn't know what to expect with level 1. It's definitely not shadowing. You're in there, you're treating these patients with another person and under the supervision of your faculty, but you are the OT. You're in the room with them, you do all the documentation. So for me, I had experience documenting when it came to teaching in IEPs, and I knew all of that. But it was a real world experience for me to document, and I feel like I am in a way better place to go to level 2 clinic and be an OT there, especially because I am pursuing pediatrics, so I'm gonna have a level 2 in outpatient peds, and I feel like I'm walking in there kind of a step above people from other schools because I have a personal real life experience in a pediatric OT clinic.
So my name is Angie, and I had the opportunity to have one of my fieldwork experiences be at St. Anne's Home in Grand Rapids. And St. Anne's is a place where the elderly, they have an assisted living area, and they also have a skilled nursing facility. So one of the things that us as students did there is we were able to, led by our faculty, we were able to become real therapists. So what we did is we created the goals, we came up with interventions. If we needed any assistance, our instructor can help us. And it was completely guided, but we actually got really hands-on with the residents that live there. The staff was super friendly. It was a very welcoming experience and probably one of my favorite fieldwork experiences so far within the program. And I highly recommend it if we continue to do this each year. And you really get connected and with your partner, but also with your residents, and you really see some change and some growth within the treatment. St. Anne's serves a lot of different elderly adults, anywhere from just a fall risk to also like maybe hard of hearing, some visual problems. You might see some traumatic brain injury, mild, come in there, a little bit of maybe early onset Alzheimer's or some memory problems there, but working with that population is just going to really encourage you and make you grow as a student clinician.
Hello, my name is Rachel. I'm a second year student here at the Grand Rapids campus of Western. I'm about to graduate this December. I wanted to give a little bit of insight on my experience at the hand clinic here for my level 1. I had a really great experience. I learned so much, and I think that I was really able to expand on my skills and knowledge base by being given the opportunity to do hands-on work versus just observing in a clinic. I think doing things for yourself really teaches you a ton, and it's great to practice your patient interactions and your soft skills and your therapeutic use of self while also expanding on your knowledge of diagnoses in the orthopedic and neurological populations. This hand clinic really taught me a ton, and I feel much more prepared to enter into my level 2s as well as into the field beyond. And having a certified hand therapist as our instructor really provided some extra helpful insight into these conditions, and I feel really prepared.
Hi, I'm Courtney, and I'm an occupational therapy student, and my first level 1 fieldwork was at Unified Clinics, specifically in the Skills for Living clinic, and it was also a psychosocial placement. So we worked with kids on their social skills and some emotional regulation, and also their behavioral skills as well. I really learned a lot from this opportunity. Working with kids, you have to be very flexible, and we also partnered our clients together, so they worked on skill building in either a pair or a small group, so we worked with other therapists as well. This clinic is equipped with a lot of resources that you typically find in an outpatient pediatric setting, and it allows you to switch from a large gross motor activity to a small fine motor activity, work in a kitchen, or just work tabletop with another client there with you.
Hi, I'm Mike, and I was placed at the Adult Neuro Clinic at Unified Clinics this past semester, actually. So the Adult Clinic is a pretty cool place. It's not meant on building new skills, it's a lot of maintenance. So a lot of the clients there are older adults with neurological deficits, so it may present more physically, but a lot of it's internal. You can't really fix it by mechanical means. So that ranges from stroke patients to TBIs to like other cognitive conditions that you may have. So I got to work actually with 4 clients, all with strokes, but not a single one of them presented just the same. And honestly, I think my documentation skills are what I gained the most out of. I got to build rapport with clients of all different backgrounds and all different conditions. I got to learn what tone really was, because you can fake that, but you can't really fake real tone. And I got to think on my feet a little bit. It required a lot of planning, and it required a lot of in-depth analysis and really honing my own skills.
Hi, my name is Taylor, and I did my first fieldwork at the pediatric clinic at Unified Clinics. And in this clinic, we were able to work with a bunch of different kiddos with different abilities, different strengths and weaknesses, and different diagnoses as well. Going into fieldwork, it seemed like a pretty big task to tackle. You had to give assessments, score assessments, pick out your intervention plan for a whole hour, and going straight from classes, I didn't know if I was going to be able to do that. But after about the first week, I realized that it wasn't that hard of a task because you had your cohort of who you have all your classes with still there with you to help you come up with ideas, bounce ideas back and forth, as well as your supervisor, who was super encouraging and even gave us the confidence to have faith in our own intervention plans that we were creating, which I think was a special experience that you wouldn't get if you were going off somewhere by yourself.
Hi, my name is Breezy and I'm an occupational therapy student. I was recently at the Work to Work clinic here at Western. This clinic is very unique. It is young adults with a variety of diagnoses who are working on independent living skills, communication skills, pre-vocational skills. What I went into Work to Work thinking that it might be a little dry and boring for some reason, and I never even imagined how much I would learn. The great thing about these clinics is you learn so much more than you could ever from even the best lecture or textbook. I learned to be flexible. I learned to relate to young adults who had a variety of levels of function, and it was just so fun to get to know them and to plan groups that I knew they would love and that would improve their interactions with each other and help also them to feel more and more confident about their volunteer work and applying for jobs. I really recommend the clinics here. They are so unique, and at the end of it, I just felt much more confident on my path of being an OT.
So I'm Christina. I'm a current second year occupational therapy student at Western.
And I'm Martita. I'm also a second year student in Western's OT program.
And we did our first level 1 fieldwork rotation at the Children's Trauma Assessment here, which is a really great experience within Western. So what we did there was working with pediatrics, ages ranging from birth to 18. And it was just an assessment center, which was kind of unique to CTEC. We did assessments throughout the day with one client, and we would learn about their histories in the beginning of the morning, kind of through a meeting, and then each of us would work with other interdisciplinary teams such as social work, sometimes speech language pathology was there. We would spend the entire day doing these variety of assessments with these kids, and we became actually very confident in these assessments because that's what we were doing regularly throughout the week or throughout the day with them.
This was unique to being a student at Western because CTEC is the only assessment center for pediatric complex trauma within the state of Michigan. So I feel lucky that we were able to be in this program and be able to have this experience as a level 1 fieldwork. Also, the experience of being able to work with multiple different disciplines and on a team where we were being trained by not only occupational therapists but also social workers and speech pathologists, and learning more about what every discipline brings to the table in regards to working with kids with complex trauma.
So one eye-opening experience that I did have was after clinic, each day we would share what we thought went well with that session and struggles that we had. And I had shared that one of my clients had met a goal, and my supervisor stopped me and said that that wouldn't have happened if it wasn't for the work that I had put in each week with him. And it really made me realize that what I was doing with the kid had an effect on his every day-to-day lives, and that the stuff that we were learning in class and putting into practice had a true purpose.
One experience from the adult clinic that'll really stick with me, I think, is one of my clients had suffered a stroke, and it was really debilitating on his function. He became scared to kind of walk around, be as active. But one thing he really liked to do was to do woodworking, which his entire shop was in his basement. With the stroke and everything, he wasn't really able to get down there, so he kind of avoided stairs altogether. He actually hadn't done stairs in about 5 years since he had his stroke. And one of his goals that he had shared with me was that he wanted to try to get back down there so he can get working with his hands again. It seemed a little outlandish. I wasn't sure what my parameters were, but I asked my supervisor. She said it may be a little too much, but why not give it a shot? And after a lot of hard work by both him and I and working together, we actually got him to do full flights of stairs at Unified with just standby assistance. And I think that experience is going to stick with me for a long time.
One of the children that I worked in the clinic, he came in with neonatal abstinence syndrome, and he had a lot of behavioral and sensory processing and kind of developmental delays because of this. And so there was some complex trauma. And working with him, he literally would light up the room when he'd come in. I connected with him on a deeper level because I have some experience both with teaching and personally with some trauma. So for him to be able to connect with him and his entire family was something that I will never forget, and I will bring what I learned from working with him, and hopefully I stay in communication with the family as they kind of progress through their journey. And it was just kind of one of those moments that it's better than what you could wish for.